We are making the report publicly available so that Jamaicans can see for themselves that an independent subject matter expert has confirmed that there is a mold crisis at the Kingston Public Hospital. The 4 operating theaters are shut down now at the Kingston Public Hospital. And what has happened is that in that moist environment, mold is growing in the operating theaters. Again, this is being downplayed as something that can be fixed. But we know the track record looking back at what happened at Cornwall Regional Hospital, and we are very fearful that the same thing is going to happen at KPH again. We as a nation cannot afford for that to happen. We have 2 Type A hospitals serving Jamaicans in the public healthcare system. Cornwall Regional Hospital is basically non-functional. Kingston Public Hospital has been the only Type A hospital in the public sector that has been carrying the brunt of all of the trauma, all of the specialist care across the island while serving the needs of the Kingston metropolitan region. Now, with KPH being downsized, it is a crisis affecting not just Kingstonians, but Jamaicans right across the island. Surgeries have been cut, understandably, because you don't have an operating theater. They're on emergency surgeries and dire emergency surgeries only. Dire emergency means that you're going to die. And so you have to rush the patient to theater. If you have an emergency and you're not going to die immediately, then you wait until you become a dire emergency. Unfortunately, there are people who are patients who are admitted at KPH now who will never make it to an operating room. They unfortunately are going to die waiting to receive service. They have tried to outsource some of the more urgent cases, cancer cases. The University Hospital, it has been a logistical nightmare. They're not getting half as many cases as they would have done. They're trying to do some at Bustamante Hospital in another piecemeal approach, but there is no coordinated plan to see how you're going to get surgical services up and running. There are some crucial surgical disciplines that we cannot afford to fall off completely. One such service is neurosurgery. With Cornwall Regional Hospital not having a fully functional neurosurgical service, we're left with just KPH. And now KPH does not have a functioning neurosurgical service, which means that if anyone anywhere in Jamaica gets a fall or any head injury, they are in serious danger of dying from something that could have easily been fixed with surgery. Again, other services that are affected, the ICU. When we spoke about ICU spaces and ventilators, the pushback was that it was simply not true. But the evidence came out from their own audits that we were lacking ICU spaces. Now, back then, a year ago, the ICU spaces at KPH contributed at least 7 total number to the bed count. Today, we're down to about 4 because the ICUs are non-functional, so they've moved them over to the Victoria Jubilee Hospital. So when you look at the whole picture, we are seeing a non-functional Type A hospital, which was the last of the 2 that were supposed to serve the entire island. And with KPH out, we are in serious danger. Please do not get sick. Drive carefully, because you cannot be guaranteed that you will get adequate medical services.